Welcome to the 493rd episode of the Jami Dulaney Plant-Based Wellness Podcast. My name is Jami Dulaney, and I'm your host. I'm a plant-based cardiologist and endurance athlete living in Southwest Florida. Thank you for listening. Hurricane Helene was a whopper for the eastern United States. I hope this finds people safe and dry. Where I live in Southwest Florida, we were not really in the path, but we got a lot of the outer bands, and really on the radar, they didn't look that bad. And Addie and I actually recorded a podcast last week in the beginning of the hurricane. But as the evening progressed, things started to deteriorate. We had several near misses of tornado-like activity that sent us to the laundry room. Thank goodness none of them touched down in this area, but the weather was, we still had TV and were able to see the cells come right up over this, a street over, so to speak. So that was a little bit unnerving. And then because we were on the dirty side of the hurricane, the water and the wind was washing up so bad. So we had waters rising in the back, which I have a little bit of a swale in the back, which is not unusual, but early in the afternoon, we were well above that, and as the evening progressed, the water came up near in the house. Actually went around both sides of the house, up over a 4-foot fence in the back and about 3 feet up on the sides to a fence. And then about 10 o'clock at night, I went out to kind of assess the situation, and there was water in the road, which I'd never seen before in my neighborhood. So we had about 2.5 feet of water in the road that was kind of coming up the driveway. So that meant I had to do a little bit of quick barricading as far as the garages go, but it never really got up to my garage, so that was safe. One of the things that I used, which if you live in a hurricane zone, think about it, was I used tarps on the inside of my garage door, and I had bags of mulch that I put over the tarps to hold them down. So I think that was a pretty good wall if need be. The other thing that I heard from a lady up in Newport Richey was that she put Visqueen up, and then she went and got kiddie pools and filled them full of water on the outside of her house. And when everybody else took water, she didn't take any water in. So, certainly in North Carolina when they had massive floodings, none of this would have done any good. But in areas where the water comes in, more of a gradual accumulation, something to think about. But about 3 o'clock in the morning, the water receded, so I never took any water in the house. I was fortunate for that. We were without power for about 24 hours, which was long enough to get the generators out and do the drill with pulling refrigerators out and hooking cords up. And so it was a bit of a workout, but again, 24 hours, I cannot complain, and then a little yard work, so not too bad. Thoughts and prayers again go out with all those people that had water damage and took in water or lost their homes. It's been awful in a lot of places. So the hurricane kind of precluded me from getting the long run in. I got most of my short runs in. I got my weight workouts in. But things are coming along. I have glimpses of yesteryear when my paces are starting to get back up to where they were. So I'm very happy about that. I just need to pull off a couple long runs before the Austin Rattler, and we should be good to go. So I am hopeful. Again, the weight workout, I'm starting a new cycle. So I believe this is week 12 of my weight training program. So I'm very proud that I've done 3 days a week of Nathan's plan for 12 weeks, and it's working out good. Every 3 to 4 weeks, we change he changes the exercise routines. I have a different routine on Monday, Wednesday, and Friday. If that's the days that that's usually the days I do weights and run a little bit shorter on those days. So it's been good. I've enjoyed it and feel like I'm getting stronger and recovering better. And so I'm even starting to like it a little bit. And come to think of it, it's not much like starting any new activity, that's a little uncomfortable or outside your comfort zone. a lot of people are starting running or starting a plant-based diet or starting a weightlifting program. And you hear online and you see people talking about, oh, they went from nothing to doing these miraculous fast or heavy weights or things like that, or I'm 100% whole food plant-based. And I got to tell you, that's not real. Real work comes from hard work that comes from gradual change. So whether it's a 5K to a 10K to a half marathon, and ultra, over years, or plant-based whole food as you transition from perhaps standard American diet to vegan, to eliminating oils, to increasing your greens. It's a process, and it can be overwhelming for people if they haven't been cooks in the past or they haven't been runners or exercises in the past. So you have to give yourself a little bit of grace and gradually increase things. Maybe get the help of someone that's done it before. Again, our program has a full-time registered dietitian. We have full-time strength coach to offer strength training programs now, and a physician to boot to help you along the way to get off your medications. Just a shameless plug, but that's what we like to do, is we like to help people make the transition in a real life way, from, where they were to where they possibly want to be, because it comes down to we need to look forward to doing things that are hard and making, accomplishments don't occur from easy. They occur from dipping your toe into the water, and things that just don't actually come natural, but you have to keep them within a realm that you don't get hurt or frustrated. And despite all the information out there, we're seeing younger and younger people have lifestyle diseases that are very serious, from cancers to autoimmune diseases. And, what's touted on TV and the internet is a quick fix. You can go to Amazon, dial in your symptoms, get a prescription, pay $11 and get some doctor to see you, or who could be AI to diagnose your problem and go forth. But I have to tell you, after years of practicing as a physician, one of the things that I like to do best is detective work, to be able to sit down with somebody and go through their symptoms. Because a lot of times if you're just filling out a form, everybody wants to pass the test. And so a lot of people may have Googled their symptoms or looked things up, and they kind of reconstruct things to kind of fit a diagnosis that they think that they have. And it's not that they're, they want to know. They're trying to figure out their diseases, which is admirable, but sometimes you can't see the forest from the trees when you're from within, so it helps for somebody on the outside to be able to ask some specific questions to narrow down what we would call the differential diagnosis of a host of symptoms to the correct one. So it's often not very quick. And it takes a lot of questions, and we like to spend a lot of time with people to find exactly what is wrong, what are their symptoms, when did they occur, and what are their lifestyle events lifestyle habits that may possibly be contributing to them. And that's just never going to happen on Amazon or Hims or Hers or any place that, medicine is just a quick fix, because we know that pills are just a patch. They're not going to make anything better. The best thing that can happen is that you get on a medication that you'll stay on forever, and you become an investor in the pharmaceutical industry. So that's kind of where we're headed when we look for easy fixes and quick fixes. Is we've just become part of the cogs in this industrial medicine complex. This is Breast Cancer Awareness Month, and typically that means, wear pink. Everybody has a pink ribbon, a pink hat, sells pink merchandise. A portion goes to the American Cancer Society so they can do research on a cure for cancer. We still say that, a cure for cancer via the pharmaceutical industry as opposed to preventing cancer in the first place. Because again, there's more money needed to be made in treating some of these illnesses. And I don't mean this to sound harsh as far as doctors, are trying to make people lifelong patients. I believe doctors are trying to help people, but the way the system has evolved, doctors don't have time to think about it anymore. All they are is, again, pharmaceutical dispensers on how to treat things and go on to the next patient. you'll hear an awful lot about screening, and, turns out that, we've all been told that get your mammogram starting at 50, let's back it down into the 40s. And the reality of it is it hasn't improved the survival of breast cancer. If anything has improved the survival of breast cancer, it's probably the decrease in smoking that we have in this country. But certainly we can't screen our way into health, or even, okay, everything's going to be okay because I passed my screen this time. Most of the time, mammograms detect the slowest form of breast cancer, even precancers such as ductal carcinoma in situ, which might actually resolve on their own. So we don't improve overall survival. We just lengthen the time that a patient is a patient. And by lengthening the time that you're a patient, involves a decrease in the quality of life, and potentially can actually decrease your lifespan because of some of those treatments. So people may not die of their breast cancer, but they die of cardiovascular disease. Or they die of the treatment, or they have severe disability from a treatment that they may have been able to put off for 5 or 6 years. Regular medicine is all about fear. Everybody fears getting cancer. It's a terrible, terrible thing because when you think cancer, you think death, or you think chemotherapy, which causes near death. But the reality of it is, why does cancer start in the first place? What triggers it to happen? And most of the time there's an environmental cause, whether it's nutrition or toxin exposures, or a patient's immune system. So by looking closer into that, we have a better chance at actually preventing things. Unfortunately, because of the liability associated with being wrong or somebody not responding to treatment, we have protocols. And there are certain protocols, depending if breast cancer is estrogen receptor positive, progesterone receptor positive, HER2 positive. And those protocols are non-negotiable in most instances. So if you go to a clinic wherever, just like going to a fast food restaurant, those protocols are in place, and that is usually the only thing that's offered. And often if women want to, say, maybe select some of the therapies but not all of the therapies, or even discuss the why, perhaps it's given their age or their reproductive status, or whatever philosophy that they may have, whether they want to go a nutrition route or want to slow things down, physicians don't even give them the time of day to be able to discuss possibilities. And if you look at most studies with regard to cancer, and we're talking about breast cancer this month, overall survival is often not part of what the study is actually looking at. We assume that if the cancer doesn't spread or progress or come back, that overall survival will be improved. But like I said before, sometimes the side effect of therapy actually decreases overall survival, and sometimes the therapies actually cause a worse outcome, despite the side effects of the therapy itself end up in causing people to die earlier than they would have. And so some of these protocols that throw the kitchen sink at people early on might not be the best for everybody. And that's one of the things that we do in our practice, is we actually work with people to talk to them about their age, their nutrition, their exercise habits, their philosophies, their mindset when it comes to cancer, how we might approach that best for them. Because again, certainly not all therapies have the same toxicities to every patient. A lot of older people, they weren't, that age group was even excluded in the studies. So we try to help people navigate the waters to decide what they want. And if people choose a therapy and they're good with it, their mindset is good with it, then they have a much better chance than as if they go into a therapy fear. Fear increases sympathetic tone, increases cortisol output, and increases inflammation, which doesn't do a cancer patient any good at all. You can't win if you don't think you're going to win and you don't have faith in what you choose. And we like to help people navigate those waters so that they have faith in the ultimate treatment that they choose. Traditional medicine, pretty much, breast cancer, if you watch it on TV, it's something that happens out of the blue to people. They had no input in it. It's bad genetics. Nothing you could have done. It's not your fault. Nothing you can do. You just need to take the therapy, sit back, and hope for the best. And so it's this fear-based treatment. If you don't do what we say, you don't stand a chance. And that's just not so. If you look, there are many ways to get around a cancer diagnosis and some of them don't involve traditional therapies. And people are quite successful. It's not an anomaly. There are different ways to get around things. And again, it comes back to what's right for you and to be able to decide it. And, I think that, being empowered gives you a better chance to heal. I was talking with a lady the other day, and it's like, we don't have any doubt that a broken bone can heal back. It somehow miraculously grows back together in a lot of instances. Even before, we didn't used to go ahead and fixate and put things together. The bone just grew back together. Kids fracture things, collarbones are fractured, it grows back together. Our body can heal from a lot of things. We can heal an ulcer, we can heal a wound, we can heal pneumonia in most of the cases. May take just a little longer. So why can't our body heal cancer? Why is that the thing that is out there that if you don't have treatment, then you're doomed? Why can't we heal everything else except when there's cancer, it's over? And I think that's something that physicians are deathly afraid to address. That there are alternatives and natural things that can be done to help people get past their cancers. And again, maybe people opt for traditional therapy, but maybe it would be even better if we looked at the whole patient nutritionally, movement-wise, perhaps supplement-wise, and took things a step further. But in traditional medicine, it's just a protocol. It's either the way of the protocol or the highway. None two can be mixed together. There are certainly some genetic markers that increase a woman's risk for cancer at a younger age and perhaps more aggressive form of cancer. But those genes have to be turned on. Something has to occur to turn those genes on. And not all of those genes are turned on. And some of the things that can accelerate the development of cancer is being overweight, being sedentary, having increased inflammation in the body. Diabetes increases the risk of developing cancers, including breast cancer. And nutrition certainly plays a role. We know that through the China study that women who ate fresh fruits and vegetables and white rice had a very, very low incidence of breast cancer in rural China compared to people that ate meat. And we also know that dairy plays a huge role in development of breast cancer. If you want a dose of estrogen, just eat dairy. And people say, well, they don't drink milk, but most people that are eating a standard American diet eat a tremendous amount of cheese. And there's a thing called bovine leukemia virus that's in milk, and it's not cleared by pasteurization, that has been linked to breast cancer. And just so by eliminating dairy, we can decrease a woman's risk of breast cancer, and we can decrease the risk of it recurring. If you give little girls soy instead of cow milk, you markedly decrease the risk of breast cancer in a later stage of adulthood. Soy in people that have breast cancer decreases the risk of recurrence. Soy is an estrogen, a phytoestrogen. It blocks the estrogen pathway, so it is protective. Not unlike resveratrol, which is in grapes and purple-colored fruits. Cruciferous vegetables, carrot tops, decrease blood vessel growth into cancer. Melatonin is a powerful antioxidant that decreases the risk of cancer and metastasis. A lot of oncologists will say, well, there's been no randomized controlled trials on people and nutrition. That's absolutely true. A lot of the ability to decrease cancer cell growth was done in what we call in vitro, so dropping different things on cancer cells and seeing whether it inhibits growth or promotes growth, or in mice type studies and in observational studies. But if you look at traditional pharmaceutical studies, they're not looking at overall survival either. They're looking at things like disease-free progression, which means the disease has not come back, or the patient, if the disease comes back or the patient dies, then they're taken out of the study. If people have metastatic disease or spread of their cancer, they look at progression-free survival. So they look for new cancers or cancer spreading. Sometimes people can have cancer spreading and they live a long time. It's not an indicator of overall survival. And again, sometimes the therapies actually cause more harm than good, and people end up dying at a younger age. So it's not clear-cut unless you find something that promotes overall survival. And then the next thing you look at is quality of life. Nutritional therapy, exercise therapy, and most supplements do not affect quality of life. If you're going to extend your life for 3 months or 6 months, and 2 months of that is in the hospital, is that okay with you? So those are things that actually need to be discussed with patients that are rarely discussed. The side effects of chemotherapy. People get neuropathy, that's forever. People get cardiotoxicities. How do you handle that? If somebody is younger, it might be more worrisome than if they're older. If somebody already has cardiovascular disease, some of these side effects may be more severe than other people. So it's something that should be at least discussed, and people should have a choice, not be dictated a form of a protocol that, this is what you should do. And you have to do your homework. You have to do your homework. It's a scary diagnosis. But again, you need to, we advocate for people, and we don't want them to be victims, because if you're a victim, you don't have the power to let your body heal nearly as much as if you're in control. There was a study recently reported looking at screening, big air quotes, for H. pylori. So H. pylori has been associated with an increase in gastric cancer. So if people get an endoscopy because they were having some stomach discomfort, they get a biopsy and cultures taken for H. pylori. It's a bacteria, and if it's pervasive in the stomach, then people are given a regimen of 4 different antibiotics, as well as omeprazole, which is a proton pump inhibitor, and Pepto-Bismol. The proton pump inhibitor increases your risk of a heart attack, increases your risk of osteoporosis, decreases the absorption of B12 and other vitamins that are essential. And of course, the antibiotics changes your gut flora downstream and leads to a host of gut and GI issues. So does it really work? And if you look at the data, again, stop and look at the data, H. pylori is in about 50% of the world's population that are screened. However, the incidence of gastric cancer is about 1.3% of all cancers, all new cancers. It's 1.8% of cancer deaths. Certainly, gastric cancer does not have a good outcome if you get it. Traditional therapy, there's about a 30 to 40% 5-year survival. And it's not really gotten better. It's not really gotten better since the 70s. The absolute rate of death has increased. People will say the relative risk or the change has gotten somewhat better. But if you look at the numbers, death from gastric cancer has not improved with all the different things that we're doing. But this study was to see whether or not you could diagnose and treat H. pylori in people that were getting a regular colon screen with a FIT test, and if that would decrease the incidence of death from gastric cancer. And it was a relatively small study, but it didn't make one bit of difference as far as the diagnosis and subsequent treatment and survival of gastric cancer. So we have a cancer that's bad, But treating it doesn't necessarily make it better. And it turns out there was a Japanese study that looked at H. pylori and gastric cancer. And, in order for those two to be connected, surprise, there had to be some other factors associated with that. So people had some sort of other stomach issues, whether ulcers or different digestive issues. And then if they had H. pylori, then the increase of cancer might be there. But it's certainly not what you would be presented when you get your endoscopy and biopsy. That again, almost 100% of people that get an upper endoscopy get a biopsy for H. pylori, and then what do you do with that? So if you're told you have H. pylori and you're going to get gastric cancer, or you have an increased risk, then most people are going to opt for this large medication regimen that again doesn't really seem to matter much. Because the death rate is, the incidence is so small, and the side effects of these medicines have never really been shown to make overall survival better from gastric cancer. Perhaps if, we looked at alcohol intake, we looked at stress-induced ulcers, medications such as NSAIDs, Motrin, ibuprofen, naproxen, and the like, increasing gastric erosions, perhaps blood thinners used in people that have stents that they didn't need. Perhaps these things ultimately increase the risk just as much as H. pylori, and not doing those might be better. We know that people that eat cured meats have an increased risk of gastric and GI cancers. So decreasing meat or eliminating meat intake, so processed meat, bolognas and bacons and sausages, all increase the risk of gastric cancer. Get rid of those, you decrease your risk. So it's a pretty low risk anyway. So if you can decrease by decreasing some of these risk factors, you're kind of home free, back to a normal weight, decreasing inflammation. All have a benefit. Having a more alkaline stomach, so dairy actually increases the acidity in stomach. Meat increases the acidity in gastric juice, which lead to ulcers and inflammation that might ultimately lead to cancer. So again, you don't have to be a victim. It's not something that you have to get screened. Screening is not going to make you not get gastric cancer, but lifestyle modification certainly can help you not to get gastric cancer. I get a call from somebody this week that told me that I needed to call their primary care and tell them about plant-based nutrition because they had a history of an MI and their doctor wanted to put them on a statin and a beta blocker, and they didn't want to be on it. And it's like, well, that's the protocol. Standard Western allopathic medicine, the cardiovascular protocol. If you've had a heart attack, it's a beta blocker and statin. Doesn't matter what your cholesterol is, doesn't matter what your heart rate is, doesn't matter what color you are, how old you are, what your blood pressure is. Those are the things that you get, plus aspirin or some other kind of anticoagulant. Same way with heart failure. We have more and more medications for heart failure that more and more expensive. There was a multi-million-dollar drug that was released in the last couple of years, Entresto, and the reality of it is the death rate from congestive heart failure has actually gone up since 2012 versus 2021. So these pharmaceutical drugs and the trials that were sponsored by the pharmaceutical industry are actually selecting for a population that we're probably harming with all of these medications. So we have polypharmacy, multiple medications. If you have a diagnosis of congestive heart failure, that risk people blood pressure being too low, that they can have syncopal events or passing out events. If they're on blood thinners, they can bleed. Of course, bleeding events because they're on blood thinners. Lowering glucose too much, they can have hypoglycemic events again and pass out. So all these different things besides just your heart failing could actually get you while you're trying to take all these medications that are often very expensive. We have been very successful in treating patients with congestive heart failure through nutritional therapy and education. Once people understand what foods are likely to cause them to retain salt and water, once they understand how much that they can exercise and maintain a normal body weight and normal musculature, people can live a very normal life with a markedly reduced heart function. They don't pass out because they're on medications that are causing them to be dizzy. They have energy, they have their thought processes. But we educate people and help them to navigate nutrition so that, again, they don't go into congestive heart failure. We work with people that have very bad hearts, and sometimes we'll see them every 2 or 3 weeks to make sure that they're on the right pathway. We even have patients, once they're educated enough, they can actually start to see whether they're retaining fluid very early on, and perhaps by their nutrition say, okay, I need more diuretic or I need a diuretic. So we can limit their medications markedly, and people don't go to the hospital. I have not had one person, I take it back, I had one non-compliant person in the hospital, but people that follow our program, I've not had one hospital, and that was actually a few years ago. I have not had anybody in the hospital for congestive heart failure, and we have people with heart functions that we would call severely reduced. So it is very possible to manage a very decrease in heart function if you follow a good nutritional path. I like to listen to podcasts, and I was listening to a podcast that I chose just because of the title. It was people running their first ultramarathon in their 70s. I find things like that very motivating, so I wanted to tune in. So I tuned in and listened to this couple talk about starting to run in their late 50s, mainly because all their kids ran. They were farmers. One was a teacher. I forget what the other, what the husband did before, but they were farmers at home, and then they become full-time farmers after they retired. And they started running 5Ks and then went to marathons and are now running ultra marathons. I find that so cool that people start things that are difficult as they get older, and they're not worried about, what their age is or what other people say or do. It's a lifestyle that they enjoyed spending time with their kids, and their kids were running, so they decided that they would be runners as well. So I always look at the results in ultramarathons. I always go to what's the oldest person completing the ultramarathon, and how many were in the age group, and so forth. And again, I find it motivating and inspirational, and it gives me hope, and because I want to keep running as long as I possibly can, so I want other people to keep running as long as possibly that they can. And so I decided to just pull up a random marathon and see how many people were in the age group rather than an ultra. And so I pulled up Twin Cities marathons, and it's a very popular marathon. It's not extremely large. I believe there were 3,677 men that finished, and 2,791 women that finished. And of those, a 79-year-old man did a 4:42 marathon, which is excellent. There were 12 people in the men's age group of 75 to 79. There were 60 men in the age group of 65 to 69. There were 5 women in the 70 to 74, and there were 2 women in the 75 to 79 range, and 20 in the 65 to 69. So that's quite a few people in an age group where if you went into the Outback or Applebee's, you would not find anybody that you would see probably that could run a marathon. And it's the company that you keep, dictates how people do as they age. And a lot of people think it's over once they retire, and it's all about just taking it easy and sitting, going to the doctor and sitting down, and they have aches and pains. And there are people that love life and keep moving. So I would encourage you to not necessarily think that just because you're older doesn't mean you can't start something new, something that's hard, change your outcome, change your body composition. It doesn't have to be that way. And I would encourage you not to, and support you, and that life is much better when you're active. And I know people that have gone through the hurricane here recently that have had to do a lot of cleaning out of water that accumulated in the house and pulling furniture and pulling carpets. And you know what? You need to be in shape to do those things, or you're a victim. The poor people in North Carolina, sometimes, the people that could walk out fared much better than the people that were stuck. And certainly bad things happen, and I'm not throwing rocks at any of the people that, that had terrible misfortune in North Carolina. But the better prepared you are, the better that shape that you stay in, the better that you can handle what life throws at you. And it's very important to train for these untold events and train to do hard things, because hard things ultimately will allow you to enjoy life more than just having to sit on the sidelines. Traditional medicine won't help you accomplish that. Traditional medicine will patch you up and let your body continue to deteriorate. If you're somebody that thinks that they would like an alternative to just getting patched up and riding your days out, if you would like to do hard things and become motivated and change and improve your nutrition, your mobility, your strength, we would love to help you. It's not the easy path. It is the path that requires work and learning. And learning increases your brain power and increases, decreases your risk of Alzheimer's. So it's a good thing. But if you're interested, go over to drdulaney.com, DoctorDulaney, and check out our program. We have only strength programs, only nutrition programs. We have dietary and medical counseling programs. We have full memberships that we work with people, again, on a weekly, every third week, every month, however people need it to achieve their goals. And sometimes we're just there so that if somebody needs us, they can give us a call and somebody will answer the phone and they won't be told to go to the emergency room or make an appointment for 3 weeks. So we answer the phone all of the time. And we help people all of the time and don't pass the buck. So if you're interested in a practice like that, go over. We'd love to speak with you. You can email me at jami@drdulaney.com, DULANEY.com, or again, if you're interested in dietetics, Addie at Dr. Dulaney, and strength, Nathan at Dr. Dulaney. Thank you as always for listening. I think we're going to get Nathan back on the podcast to give some shoulder strength training here in the near future. The other thing that I have in mind is to do some live events and Q&A. So hang on, and we'll get some of those going, and the ability for you to potentially participate in a live podcast. So thanks as always for listening. Talk to you next week.